most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to stop hip pain and increase motion of your hip.
That's right.
With advanced hip muscle self-treatment.
Right. Things you can do at home. They're advanced. I've got a patient right now working with it. Great feedback, and I wanted to share it with people.
Why don't we talk about that in just a minute?
Sure.
If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, bobandbrad.com. Go to the giveaway section. We're always doing a giveaway contest. Right now, we're giving away some Bob and Brad exercise bands, right?
That's right, Bob. We'll show them just as soon as we get this board.
Go to Bob and Brad on Facebook. It'll also be pinned to the top of the page.
That's
the contest.
right.
Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. In fact, we actually have a Bob and Brad clips that are 60-second versions of our program.
Yeah, that way you don't have to listen to us babble for so long. But that's all right. Some people like it. Here's one of our bands right here. We've got it. I love these handles. We've got a couple on the wall with the anchor. Are you going to go over there, Liz, or no? Oh, good. His head. So I mentioned, Bob, that I've got a patient right now. He's our age, late 50s, well, 60.
Quite old.
Anyways, very active carpenter, and he had a stroke on top of a hip that's literally wearing out from arthritis. And so
tough combination.
Yeah, he was in tough shape. After the stroke, he was not as active. The hip was already tight from the arthritis, even got more tight. Miraculously, hard worker, did his exercises, his treatment. He's almost 100% recovered.
Yeah, I met him the other
stroke.
day. I was like, I couldn't tell.
Yeah.
I mean,
so now it's his hip. It's
Sure.
tight. He's going to get a replacement done within the next year. So he can go back. He plans on working full time again.
good for him.
Yep. He's ready to
Bravo,
go.
bravo.
So this hip, and anytime you've got hip pain, whether it's from arthritis or from an injury, and you don't use it, the muscles tighten up, and you've got rather large. You got your glute muscles on the back side, and that's a large group. And then we have in the front, we need to get into these muscles, which are deep.
The hip flexors.
Yeah, hip flexors are deep. There's a little bit of visceral or your internal organs kind of get in the way a little bit. We'll show you how to get around that. So the first thing we're going to start out with is what I've found with my patients as well as us, which works best. You do need to spend a little money on this, but
it's money well spent.
Exactly
because you can not only use it on your hip, you can use it over the entire body.
Exactly. So what we're talking about is one of these power massage. Now we've got this one. This one, we really like it. It's inexpensive. It's built well, but it's
inexpensive.
but it's not strong enough for these big hip muscles unless you're a pretty thin person.
Yeah, if you're an elderly person that's quite thin, that's the one you may want to get.
Exactly. So the two that I went with this patient was the bigger one, like this. And I've got orange on there just so you can see it.
You taped an orange strip on there so you can see it.
When I get it on, because black on black, you won't be able to see. But now with him, with the hip, we should go through just a little anatomy with Sam. Get over here. Yeah, there we go. Let's flip him around. So here's the hip, and you can see all this hollow spot around the hip joint is filled with muscle. We've got to get in there deep. That's a lot of muscle to work through. So we're going to work around the hip joint. If you can use your imagination, we'll show you like this. And this is exactly what I showed him. So he had a good visual on. We're trying to get in, loosen these muscles up, increase circulation, which is going to allow things to heal, stretch it out, get it softened up so we can stretch it. We do have a video that we just put out on advanced hip stretches.
Yes.
And that just came out a couple weeks ago. So the idea is to use this, and then you can use those stretches afterwards. So on your bed or on the floor, you're going to be like, this is my tight hip. Get my cord out of the way, and we're just going to work it. Now, this has got 5 different settings. I usually go on number 3. It gets too aggressive otherwise. And you can just work in here, and you're going to work in those muscles, and you're going to do it for 30 seconds to a minute. There's really no right or wrong on that. You'll get to know. Yeah, I mean, you're not going to be here for 20 minutes, but and you work, and you'll feel the knots, and you're going to work on those and work, and you can change your position of your leg. You may go way up here and work on it. It makes a big difference. And also want to get the side of the hip. Now, do not go on the the hip
The bone itself,
the
right?
trochanter.
Yeah.
We showed it on Sam there, but right there's a bony. Do not go on the bone itself. It's not going to do any good. It's going to get you sore.
Well, you're gonna feel it.
Yeah, it's just
Yeah.
you'll know. I mean, some people might think pain is good, but it's not the situation. You should feel
No,
good.
it's a good hurt.
Yeah.
And by the way, this one's a lot smaller, but it's still very powerful, and it can be used on a hip. My son,
Yeah.
who's kind of a big kid now, he's 240 weightlifter. I mean, he came home and he's like, he really liked this one
Yeah.
because you can get the leverage on it,
And-
and it's less expensive, and you can carry it in your pocket.
Right. As a matter of fact, I had him use the big one and the small one. My patient, he said, "Boy, this one feels so much better in my hand," and it was plenty
Yeah.
powerful enough for him. So this is the one. His choice is this one.
Sure.
And they both come with 5 heads up there. They
Right.
have carrying cases.
I don't know
We're
if you can see
really,
that's black on black again.
we're really happy with
Yeah.
with the quality and the versatility of these
You
massage
see really
guns.
high reviews
Yeah.
on Amazon.
Now you can get. Now we said the front of the hip is hard to get into. You have to be careful with the massage gun. You don't want to get over your lymph nodes and beat those up. So you want to stay away from those that are on the femoral crease. You want to stay on the muscle. It should not be painful, and you can still get in there deep. Now Bob, he likes to use rollers.
I
which
use a
are
foam roller.
which is our second.
Did it this morning
Yep.
because I was having trouble with this area.
Sure.
It's definitely an area of concern for me.
Yep.
And it was sending pain down the front of my thigh and groin, and I think I was getting some pinching in there.
Sure.
So it's a great way to loosen up those hip flexors before a run.
You don't want to forget about the groin muscles that's
Yeah.
on the inside there, and you can work those, and because those all are part of the hip, and they're
I foam roll that too.
Yep. Okay,
So-
so that's it. And again, you could probably spend a good 5 minutes on your muscles with just a massage gun. If you don't have the the means to get one, or you don't want to have one yet, you can use a foam roller. We're going to go into what you can do with a tennis ball or a softball in just a second as well.
Sure.
Bob,
Foam
you
rolls
wanna-
over here. Do you want me to do some foam rolling?
Yeah, show how you get
Okay.
to the front. I just was talking.
Sure.
about.
And this is a little graphic maybe, but my wife always says looks like you're having fun there without me. She said.
Well,
It's-
it is
so-
a family show.
yeah, I know it's a family
That's
show,
how
but
they
I
get-
just put kind of brace on this one a little
Sure.
bit, and I just roll right onto it. I roll all the way down to the quad.
So you get the quad muscle.
Yeah, a little quad to
Might
it,
as
and I
well
get the hip,
whole-
and
yep.
then I roll over to the side a little bit. I gotta watch my mic here,
Yeah.
and I get the hip adductor then
Yep,
too.
Yep. Yeah, that
So-
one's a little challenging, but you'll get in there.
No,
you know.
it works. It because I was having trouble with it, and it works real well.
Yep.
So, and then you can jump right into hamstring if you want. You can just lie or sit like this,
Yep.
and I get hamstrings and I get heel.
And you can work your way up into the
butt.
butt up closer to
Right,
the hip
right.
too.
Yep,
If you cross your legs, then it gets that's
a
going
lot
to work.
more intense. Or
on
if you
one
go one
side.
leg, it goes a
Yep,
lot more.
Yep.
Oh.
They do make these now. We do have one of these we really like. It's not quite out yet, but you can still get these. Now this
It's
is
a
you can see it,
vibrating
it's
foam
knobby.
roller.
It's more aggressive and it vibrates. It's got 3 different settings. Let's see if you can see it vibrating there. And again, you're going to work it the same way as
This is actually the one I use.
Oh, it is.
I like aggressive. I mean, this is
this is advanced.
yeah, this is advanced. This is for somebody who, I feel this way more than the other one. Again, I'm working on that groin again and on that hip flexor.
Yep.
So, and, again, there's, we'll put a link below for a similar one.
Sure. Yep.
This isn't out yet, but it will be out in
Yep.
hopefully
Yeah,
a couple
so,
months.
These are not really hard. I can push into them, so they're forgiving to a degree. It's not like the hard plastic. Just a good idea.
But it is aggressive. I'd say it's about as aggressive as you can get with a foam roller. So
Say no
I
more.
love it.
Yeah.
Wow.
I don't use one, but so Bob, I use this one actually at home.
Sure.
Now I have, and I still do use the ball sometimes if I don't have that available. You can just take a tennis ball, and they work quite well.
Sure,
Uh,
we give you an inexpensive option here.
Yep.
Some of you might have at the houses.
And you have to get used to, because if I put all my weight on that, it's pretty aggressive, and you just roll around. The impulse of the massage gun really gets into that muscle and gets it loosened up better than this, but this is still good.
Easier to control, too,
Yeah,
I think.
yeah.
But you can use a lacrosse ball.
Yeah.
You can use a softball.
Yeah.
You can use.
Now the lacrosse ball is quite a bit harder. Same thing. It's just as more aggressive. You know, the softball. You know, you could probably work the front of the hip with this. It's a little bigger
Yeah.
and work it on there. And I've got my weight through my forearms and my toes, so I can control the weight well. Again, when you work in the front, watch out for those lymph nodes.
Yeah.
'Cause they're pretty superficial just under the skin, and we don't want to get those flared up. So just be cautious on the front. Work the back. You'll notice that the side and the back you can get more aggressive with.
And I've said this before. There was actually a NBA player that played for the Timberwolves,
Sure.
and he was way kind of up there in age. I think late 30s, maybe early 40s, and he
For-
used to use a softball. all the time.
Softball was his
Yeah.
go-to thing.
Yep.
Yeah.
And that's what.
Maybe they didn't have those. Maybe he
I
couldn't-
don't know.
He probably couldn't afford one.
Yeah,
Of those.
I think you could afford it, Brad. So,
All right.
all right. I think that's it, isn't it, Brad?
Yeah. Good luck with working on those hip muscles. Get them nice and pliable.
Yeah, be able to take your hip and put it up over your head.
Right. Again, remember the advanced Bob and Brad YouTube channel. The advanced hip stretches will show you how
Sure.
to work.
Check it out.
Yep. Get you moving back into gear.
Peace.